I'm glad to have the opportunity to raise this on the floor of the Dáil. It's something that I've raised previously in the Health Committee. Currently in Waterford we are without a hospice, and it's not just Waterford that's affected, it's the whole region of Waterford, Wexford, Carlow, Kilkenny and Tipperary, taking in a population of 500,000 people. So as we approach 2015, we are still in the shameful situation whereby the southeast of Ireland does not have a dedicated hospice building. I will say that work is underway to addressing this, and it's thanks to the hard work of all the local hospice movements across the southeast, and particularly in Waterford. A design team was appointed this summer and meetings have been getting underway with the architects. It's hoped that the planning application for the unit will be lodged in March 2015 and the building will start in the summer of 2016 to be finished, I hope, by the end of 2017. All well and good, and we look forward to seeing the work progressing. However, it's currently costing Waterford Hospice around €600,000 annually to provide home care services. Most of this amount, 67%, has been raised through donations, through the likes of coffee mornings and sunflower days, local fundraising by very loyal supporters. The HSE provide just 33% of the remaining funding required at present. So we can see that there's a lot of money being raised locally and being spent locally on the hospice home care packages. And from my work with the Hospice Board, led by their chair, Danette Connolly, I know that the local board have always said that the HSE locally have been very supportive and helpful to their work. But Minister, while they are being helpful, as you and I both know, it's money that talks. And I have here, Minister, a rather alarming document. This is the response provided to a recent parliamentary question which when I requested the detailed breakdown of the funds. It makes for stark reading, Minister, and I'd like you to listen as I just go through the figures for 2014. Milford Care Centre in Limerick, 11.5 million. Galway Hospice, 3.36 million. Northwest Hospice in Sligo, 2.59 million. Our Lady's Hospice in Harold's Cross, 13.23 million. Marymount Hospice in Cork, 6.5 million. St Francis Hospice in Raheny received 7.1 million. So we see here from the figures, Minister, that other hospices around Ireland, from Sligo down to Cork, are receiving between 13 to 3 million euro each year to fund services for people who are at the end of their lives. But the South East is not a pleasant picture. The figures up until September of 2014, the Waterford Hospice movement received the miserly sum of €140,000. The Carlow Kilkenny home care team received €160,000. The Wexford team, €150,000. And the South Tipperary, the local hospice movement, got €170,000. So the combined hospice services in the South East to date got €620,000 from the HSE up until September of this year. And we do not begrudge the money to the other regions or the other areas of our country, looking after very unwell and people managing pain and people managing the ends of their lives. But the figures that I have seen show that the South East Hospice normally gets around €800,000 per annum, still the lowest amount to any region in the country, Minister. Minister, this is why I'm raising this issue in the House today. The people of the South East, as I said, do not begrudge the people of Limerick or Sligo or anywhere else. But it's hard to read these figures in the awareness that not only are the people across Waterford, Wexford, Carlow, Kilkenny and South Tipperary being asked to fundraise for home care services, but they're also being asked to raise a significant amount of money, €6 million towards the palliative care unit.
Thank you very much, Deputy.
Looking at these figures, Minister, anyone can see that the South East is missing out on a very big piece of the pie.
Thank you, Deputy. Minister, you have 4 minutes, please.
Thank you very much, Cathaoirleach. Could I just, to start with, thank the Deputy for raising the issue, because palliative care is an integral part of the delivery of health service. I think, though, that we should, I have a little experience in this, but I think we should as well be conscious of the fact that palliative care is not always about the exact end of life. It's about ensuring that people who have a condition that will in their lives can have a quality of life for sometimes a prolonged period of time, which will allow them to live the best life possible for them. The other thing I would like to say to you, Deputy, is, and I take very much on board everything you've said here, is that I know for a fact that the fundraising committee in Marymount in Cork, the one I would be most familiar with, actually raised 28 million in order to put in place that fine hospice that is within Cork. But I accept fully that there is a huge area of the country as well that doesn't have a hospice to serve the people of that area, and I would like to thank the Deputy for raising this year. Direct budget allocation for palliative care is 73 million in 2014, but this does not include expenditure in relation to specialist palliative care provided in 38 acute hospitals, approximately 170 palliative care support beds and designated home care packages. Most of the HSE's palliative care budget is provided to the main voluntary hospice organisations to provide palliative care services, including inpatient beds, home care and daycare. The funding is provided under an annual service level agreement with each organisation. Many agencies also provide additional services which are resourced through charitable fundraising, and as the Deputy has already said, that's clearly an active part of what happens in Waterford. I am aware that Waterford Home Care Services rely on voluntary fundraising to supplement the funding it receives from the HSE. This is also the case for the other palliative care home care services in the South East. The HSE funds about 40% of the running costs for each of the 4 providers. All of these teams provide support for palliative care patients with both malignant and non-malignant conditions, and all provide a 7-day service. These teams and the fundraising efforts behind them provide a vital service for people with a life-limiting condition and their families in the South East. And this government greatly appreciates their efforts to ensure quality of life for patients with life-limiting diagnosis. I would obviously like to see increased support for these services, but despite better economic indicators in recent times, funding remains under pressure right across the health sector and will remain so for quite some time. And it will remain very challenging to secure additional funds in these circumstances. I'm also aware that Waterford Home Care Services have agreed to raise 6 million to cover the capital cost of the new 20-bed specialist palliative care inpatient unit to be built as part of the redevelopment of Waterford Regional Hospital. The unit will act as a focal point for the provision of specialist inpatient beds and community and day services for patients and their families living in the South East. There are currently 6 similar proposals for new hospice units at various stages of development across the country, where the voluntary hospice groups propose to provide the capital funding on the basis that the HSE will take on the ongoing operational costs. This year, 16 new beds have opened at Marymount in Cork, and all 24 new hospice beds in St Francis Hospice, Blanchardstown, will be opened by the end of the year. The University Hospital Waterford project, including the palliative care unit, is included in the HSE's capital plan for 2014. It is expected that the planning application will be lodged in March 2015. Construction is planned to commence subject to funding approval in the second quarter of 2016 and will be completed in Q3 2017. Following commissioning and equipping, the unit is planned to open in early 2018. I do think, Deputy, and if I could just, Chair, just very brief, I do think, Deputy, that the provision of the structure sometimes brings, and I know it does bring additional funding, and this will help as well in relation to provision of service in that whole area.
Thank you very much, Minister. Deputy Conway, you have further 2 minutes.
Thank you, Chair. Thank you, Minister. Minister, yeah, I mean, I'm really delighted that the palliative care unit is in the capital plan for the HSE. You know, other governments reneged on their promises over the years to the South East and to Waterford in that regard, and I'm really glad, and I know that the people of Waterford and the fundraisers and the activists on the ground behind this issue are so glad to see a finishing line in sight. But Minister, my point is, about, and you're right, and I apologise if I didn't, when I spoke about life-limiting illnesses as well as end-of-life care, you're absolutely right that this is, something that it's not just a once-off for people, but can be an ongoing service right throughout somebody's life to improve their quality of life. And Minister, you and I both know that it's in a patient's interest to try and keep them at home for as long as possible, and that's why the work of the home care team, who do incredible work, and I've seen it firsthand, the kind of work that they do. But because the local fundraisers have to subsidise the home care packages, because of the little amount of funding that we get vis-a-vis the rest of the country, that money could be diverted into the bricks and mortar of the hospice building, and that's the issue. And the HSE locally have been very good and have a really good working relationship with the hospice. And I mean, what we're going to have as the end result is not just a hospice unit on the grounds of Waterford University Hospital, but a 5-storey building integrated into the plan of the hospital. It's going to be an incredible facility for the people of Waterford and the South East, but in the interim, it's the home care services that are so poorly funded vis-a-vis the rest of the country. And Minister, I would like you to maybe ask Minister Varadkar, why is that the case? Because it's a population of 500,000 people, and only about 33 to 40% of it has been funded by the HSE, whereas I understand in other regions of the country, those wonderful nurses who go into the home and provide such great care, their salaries are paid for by the HSE and not out of the buckets of fundraisers.
Thank you very much. Minister, final 2 minutes.
As I say, I suppose I have a little bit of knowledge, just personal knowledge of it, and it's something that I would have an affinity with. And yes, of course, to be able to increase the budget in this area would be an objective. And it's not something that's been forgotten. We're very familiar with what happens, and especially the home care teams. And there is an interesting development in terms of, I suppose, established hospices now, is that because people are staying and being maintained at home for such a long time, that it's only people with huge levels of need and demands are now going into the inpatient hospice bed. But as a result of that, there is a difficulty in funding in that, because their needs are so great that the fundings, even in the very established hospice, they're now finding it difficult. Fair deal has to be part of it. And the other thing I think as well that we need to be very conscious of is that the VHI needs to be, and they are in terms of the beds, but they need to be conscious as well that, if you're paying VHI all of your life, then it just cannot suddenly stop. When you come to the end of your life, for that little piece, that's at the end of your life. And in lots of cases, they're very conscious of that and do deliver. But we need to have a conversation with them around how best we can do that as well. But it is far more complex, I think, than people imagine. And I think that if you were to talk now to most of the voluntary organisations that deal with palliative care, they will clearly tell you that the complexity and the needs of people during that journey, and it sometimes can be an extensive journey, is far more complex than we thought. But to increase the budget, of course, Deputy, would be a magnificent thing to be able to do, and it's not something that will slip off the agenda. It's something we're very conscious of.
Thank you very much, Minister.